Few professions have a more direct impact on the well-being of our community than teaching, nursing, and social work. Despite their immense value to society, these fields face persistent and critical workforce shortages at a time when demand is only growing. To discuss the solutions needed to strengthen these essential workforces, we welcome UMass Global Chancellor and President's Forum Chair, David Andrews, Utah Hospital Association President and former hospital CEO, Francis Gibson, and National Conference of State Legislatures Federal Affairs Advisor, Austin Reed. Thanks for joining us today, gentlemen. Let's get straight to our first question. Austin, I want to start with you, and I want to start with the most fundamental question. Why are we talking about workforce needs for high social value jobs today?
Well, right. From the perspective of legislatures, these are jobs that matter significantly for economic development and frankly the welfare of communities and citizens with often the greatest needs. I think from just broad workforce perspective, of course, state legislatures are interested in do their citizens have jobs? Do they have good jobs? But they're really interested in do they have jobs that are furthering broader economic development goals and societal goals? And we think about teaching, nursing, social work, all of those professions not only help advance societal goals to make sure that we have a healthy, well-educated, well-cared-for society, but they are increasingly tied to the economic performance of states. We know that, for example, workers can't go back on the job if they don't have sufficient childcare or even health care. We know that a strong teaching workforce means that schools are producing students who are ready with the skills to succeed, and that pays dividends for economic development for states over time. And so these broad shortage areas, when we have these shortages, they really can be a drag on the state's welfare and the economy. But we also know that shortages tend to have really acute impacts, and they often manifest in the communities with either the greatest needs or the ones that are hardest to serve. So I think about these shortages are really particularly felt in rural and even urban communities. And then oftentimes we see shortages around specific skills and training that have really significant impacts. So we know that in the teaching profession we see shortages in STEM, second language, disability education, and these jobs are really vital to promoting success, but also supporting students and citizens with the greatest needs. So these are really critical jobs. They matter significantly for the health and well-being of states and their state economy.
Great. Francis, we're coming your way. From your perspective, why is this an important topic today?
Oh, I think when you specifically spell out nursing and social work, right now we have a mental health crisis in this country. And we look at the amount of social workers that are needed. Before, for so long, we thought it had to be a psychiatrist or it had to be a psychologist. In medicine, we're shifting from MDs, we're going to nurse practitioners, we're going to physician's assistants, and social workers can be sort of, if you were to think about a mid-level provider in the mental health space. Though a social worker cannot write a prescription like a psychiatrist can, what social workers are allowing, they're the great connector for resources in the community. They're able to provide therapy, counseling, teaching in terms of helping these mental health patients that are clogged in the emergency rooms, for example, and coming into the hospitals because of lack of resources. That is the first site which they come in to look for help. I think social workers do a great job in crisis intervention, case management, getting people back into the resources in the community. When we talk about nursing, there's a nursing shortage. We look at backlog, and at some point we'll probably talk about this, but just a backlog in university in terms of the amount of slots available for nurses to come in. We look at the big exodus of nurses coming up, nurses that are retiring. Do we have the right amount of people to replace that retiring gap? Nurses are the key extender to care where we have a lack of physician. For every physician in the hospital, we probably need 4 to 6 nurses to support that physician. And that ratio is really big and seems to be getting bigger.
David, I know you kind of have, you're an interesting one in your experience here. You can relate very, very well to what Francis just said from kind of the healthcare, the social work perspective. And as an educator, tell us, why is this an important topic for you?
Well, these professions that we're talking about, we used to call them the helping professions, which is a warm way of saying these are the front line, first defense that we have as a society, and they're especially meaningful to our most vulnerable populations. We need great teachers, we need great nurses, we need great social workers. I would put public safety in this same space, where we need public safety. And our communities really thrive when we have this fabric woven together to support individuals and families. And they really are the front line of defense. We can triage later and get them to more specialized services, but we really need this stable workforce. And the other side is that in these helping professions, a large percentage of the activity is relationship based. So these are individuals who build relationships with the people that they are serving or the people that they're helping as a helping profession. So teachers and their students, nurses and their patients, social workers and their clients, public safety and the community, public safety officers, both fire and police. And so when you have high turnover in these professions, you have a double-edged, a double impact on the community, because you're losing those relationships that are so central to the fabric.
Right. Okay. Well, I want to kick off a little bit of crosstalk on this, and I'll start it like this. I know at least two of you, David, you might surprise me on this, have extensive experience in state legislatures, as Francis was in leadership in the House of Representatives and in the state of Utah. And Austin, you're working with legislators from across the country on these issues. And I'm assuming that this is pretty universal throughout the country, this need. Am I assuming correctly on that?
Yeah, I mean, I can speak broadly that this is something that we're hearing about across states, and it's interesting. I've typically interacted on this particular topic through the lens of higher education, but also work on our K-12 portfolio, and you often hear about some of the most acute challenges of the K-12 world are directly tied to the kind of workforce that higher education is preparing. So we've heard, quite a bit about, an increase in students that are learning a second language, and there's a shortage of English language learning certified teachers. We've heard especially that there's been a real bipartisan momentum towards more mental health supports in schools, but we know that we need more social workers to do that. And there's been, very demonstrated demand and even shortages in that profession. And of course, even beyond that, this is beyond my area of expertise, we know we have an aging population and there's going to be more care that are required for that. So you need more nurses. So, when it comes to, I think the basic parameters of making sure you have the workforce that can support an economy and well-being of your state citizens, this is something that, everyone's pretty bought in on.
Yeah, I would add, nationally, as I go across the nation and we go to Washington, D.C., and just look at the American Hospital Association and listen to colleagues who are presidents of the hospital associations from various states, the need for healthcare workers is enormous, and it goes beyond nursing. Respiratory therapists is a huge, huge issue. And when we start talking about whether it be environmental changes and what respiratory issues or conditions look like, depending on where you're at in the country, we start looking at the aging population we've already talked about, and just unique diseases that come as you get older. I would love to say that the United States is a healthy country. I don't think we can say that. There are lots of elements that other countries don't have that we seem to be suffering from. But whether it be respiratory therapists, whether it be nursing, whether it be physical therapists, and looking at just rehabbing, getting people back to living healthier lives, phlebotomy, there are a whole host of issues that there seem to be a shortage of. X-ray technicians, MRI technicians, CT, ultrasound. I think we could go down as I look at my peers across the country. We may speak in a different dialect, we may have a different accent, but the needs are the same.
David, you've seen this from coast to coast in higher ed. Tell us your experience.
I would say both in higher ed and specific professions. And I'll push back a bit with the other panelists in that even though we do have a kind of a universal need in some of these helping professions, we really have to target those places where we have the greatest need. In education, for example, it's special ed. And when we talk about teachers, we have plenty of humanities professors in higher education. Don't need any more. But we do need to have English as a second language. We need special ed. We need math. We need science teachers, and the same across other professions. I'll pick on dentistry. There's a shortage of dental hygienists and dental professionals, but not as big a shortage of dentists themselves. And so I think we have to be careful about both the professions and the subsets of those professions, but also the geography. Our deeply urban areas and our rural areas are suffering the most from these shortages.
Right. David, I'm gonna stay with you, and we're gonna talk a little bit about the barriers to aligning higher education with workforce needs that you're talking about. We have a perspective here from education, from policy, and from industry. So, David, we're starting with you in the education world. Tell us, what are the significant barriers that we have to deal with?
Well, since we have a short period of time, it's going to be difficult because there are a lot of barriers in education. And one is this assumption that just because we need these people, we can find them. These are difficult jobs, and they're often lower paying jobs. So as we're looking at students coming into higher education, getting them to move into these careers and or change their careers in this direction is oftentimes a big challenge for us. And so just aligning with the needs of the workforce is not enough. We have to have delivery models that allow us to access students who are willing to make this shift, but can't stop their lives to do it. We serve a lot of working adults, and these working adults can't quit their jobs to become a teacher or to become a nurse. So we have to think about solutions that allow people to go on with their living, supporting their families and their current jobs, and make these transitions as smoothly as possible. And there's a regulatory environment that keeps us from doing that. Most of these professions have a clinical experience that's required, and oftentimes required full time. It's very difficult to find an adult, even a young adult, who can dedicate that type of time and energy to a particular profession, especially if it's a lower paying profession. So we've got some work to do ahead of that, and some of it's regulatory.
Right. And speaking of regulatory, Austin, we're moving in your direction. From policy perspective, what are some of the barriers?
Yeah, I've had the privilege of working with a task force of legislators really focused on key issues in higher education. And through a 2-year study, they sort of came up with this very simple bipartisan vision for what they wanted for higher education, which I think really speak to the barriers. They want students to be able to actually get a degree. They want a student to get a meaningful degree and at an appropriate cost. And we know that for so many students, not all three of those things are true, and they really speak to those barriers. In terms of access barriers, of actually being able to get the degree, I think David really started to hit on those points well. Are we actually recruiting students into the fields of needs? We do have too many elementary school teachers, probably not enough disability education teachers. Are we recruiting students that can actually fill those needs quickly? Are we relying on high school graduates to take 4 to 6 years to complete their degree before they enter in the workforce? Or are we targeting those adults that already have skills that might be able to reskill and upskill in a program that can then fulfill those needs much more quickly? And to David's point, are we actually creating programs that are centered around their needs? Was a real key theme and barrier that the legislators identified. Of course, then there's questions about degree relevance. Does the actual program prepare for success in the job? Having a little bit of experience around teacher prep and having been in the high school classroom myself, there's not always as much alignment between what happens in the teacher prep program and what happens in the actual classroom. It's sort of surprising. And then, of course, a big one, and I bet I'll touch on this a little bit more later, is do the costs of the tuition align with the cost or with the salary that students are going to get if they enter into those fields? I think that's a huge one, and one that policymakers are in position to really address.
Yeah, good call out on that. Francis, we're coming to you as the experience that you've seen. Rubber meets the road in the healthcare industry. What are the barriers?
Well, I think I don't want to say the quality of education, but maybe I would just say the rigor. And are we spending time teaching skills that are actually going to be used in the industry? For example, do I really need my cardiovascular nurse or my ICU nurse being well versed on history of Europe, or some of the fine arts, or some of the classes that are required to take a degree, which also enhances tuition cost, right? And I don't want to pick on history majors, but I'm just saying, is the class load that we're taking relevant to the jobs that we're going to be out there? I think we have a lot of private for-profit schooling that is now coming up. They're eliminating some of the things that don't matter, and they're tooling people for the workforce when they get there. We talk about technology. Everyone, AI is the hot topic right now, right? And how does AI apply to healthcare? And are we being trained on proper dictation notes, physician and pharmaceutical needs, and how they meet certain diseases? And I think AI is going to play a big role in how we provide healthcare moving forward. And to be honest with you, at fear of offending someone who may watch this, the accuracy level that we're going to be able to cut down on mistakes and misdiagnoses is going to just totally enhance. And we don't even know where it's going to take us. But I think being able to accept what AI can do moving forward is going to be really big.
Yeah, very interesting. Probably a great place to start this crosstalk. I'm interested, David, what you think about what the point Francis just made.
It's a great point, and you got my attention there, and especially from a university perspective, because we often get blamed for not being relevant in the creation of degrees. And I would back off and say it shouldn't be about degrees. It should be about credentials. And it should be about skills-based credentials. But the entire system is set up to reinforce us in the delivery of degrees that are controlled by the U.S. Department of Education and the accreditors. And a group that's missing from this conversation are the professional associations within these disciplines, who often become a barrier themselves because they require degrees. And within those degrees, in order for them to be degrees, whether it's a bachelor's in education or a master's in social work, you have to include those elements of a general education that allow you to move forward. And you also have to deliver it in a time frame that's based on Carnegie units. So the expense side on the university side is really not the university's sole prerogative to control. It's controlled by our accreditors, the U.S. Department of Education, and the professional associations. And I'll just be candid, we just got out of nursing as a profession because it was too expensive to produce one. And it's the California board that requires us to do things that, in the interest of quality, that make it too expensive to produce a nurse relative to both for them and for us. And we've exited the field.
Yes. Speaking for our higher education task force, we didn't spend a lot of time thinking about AI, but as we have this conversation, starting to realize where that impacts could be felt. And I think it's particular as AI sort of changes demand in certain jobs, how nimble will higher education be to make sure that they're aligning the kind of programs that they're offering to the demands that's actually in the field. And going back to our first question, regardless of what AI, does in the job market, I think we can expect that the care economy is still going to have areas of really great need. And so, I think as we think about what legislatures can do to promote high degrees of social value, it's making sure that they're in communication with the institutions, but as well as industry, to make sure that the way that the programs are being structured, but also just the availability of programs, are actually meeting the workforce needs of the future. And we might be in a time where that's going to be fairly dynamic, but there are a few things that we can expect will be pretty certain. And that's that, these high social value degrees, they're going to be just as valuable as ever.
I think as a society, where do we put the most prestige or most value? We talked about we have a lot of dentists, but we're shorter dental hygienists. Well, maybe it's sexy to say that I'm a dentist, but I'm a dental hygienist, not so much. Or I'm a nurse and I'm not a doctor, or I'm a psychiatrist and I'm not a social worker. But when you go, you go to Norway and the Netherlands and places like that, if you're a teacher, that is a highly sought after job to be a master teacher there. Incredible emphasis put on that. And we in the United States, well, you're not a doctor, you're not a lawyer, you're not an engineer, so somehow, or an accountant, so somehow you may be a failure. And I just don't know that that's, as a society, where we put in our value and where we really put in our emphasis. And those are the folks who really make it work.
Good call out, Francis. Let's change our focus now to solving, or at least talking through, a couple of these solutions. Let's talk specifically, either in your field, or you can talk more broadly. How can we improve the success of workforce development programs, and how can we increase retention in these vital positions? So, Francis, we're coming your way first. What do you think we should be looking at to solve these problems?
Well, I think streamlining the education, let's get down to whether I'm a nurse or whether I'm a phlebotomist, I'm an x-ray technician. We talked about respiratory therapy. What are the core things that we need in our job? And let's really focus on education of what that looks like. Try to take some approach to looking forward thinking in terms of integrating technology. But I think one of the things for me that I see the most are those soft skills, those communication skills, how to care for people, how to communicate with a patient. No matter how computerized, how much technology we get, I think there's always going to be a need, at least in my industry, for that hands-on approach, that touching, that feeling, that emotional connection that assures people that you're going to be okay. You're going to be able to live your best life possible. We live in a world, I'm holding my phone in my hand right now. We live in a world where we swipe and everything is here. And the ability to communicate is not there. I think our young people need to be able to know what it means to have a conversation, to listen as much as we speak, and to be empathetic. And those are some things I would love to see us, at least in the healthcare field, to be able to embrace, while eliminating some of the things that teaching, that just because we have intellectual superiority complex that we need to pass it on to everybody else, that's probably not what we need to provide good care and to get people healthy again.
Right. David, you brought up something in our last question that I thought was just like the synopsis of this whole panel discussion, and that's the decision that you made as a university administrator to move away from a certain degree program because it didn't make financial sense, and you couldn't get the income outcomes that your students need. So if you're going to put students first, it makes it hard. In nursing, for instance, California, I'm curious to know, what do you think some of the solutions could be to that issue?
Well, I think we have to, and it goes back to this promotion of durable skills. We've got to prioritize the kind of things that we want to spend money on building the skills for in face-to-face or connection-based, relationship-based professions. And in order to do that, we have to take all of the content delivery, the acquisition of knowledge, and use technology to deliver that in a more efficient way. Because what we're seeing, and I think Francis is right, we're seeing this progression where precious time with each other, whether it's digitally, virtually, or actually face-to-face, is being replaced by time that we're spending in technology. The time around technology needs to be in content delivery and content acquisition and knowledge acquisition, because we don't have to do that together. And so I often lose the argument with faculty, or impressed on the argument with faculty about why are you still lecturing to 30 students at the same time? We don't need that anymore. Content delivery, especially one-way content delivery, is free and ubiquitous. We need you to vet it and to credential students, but I don't need you delivering that kind of content. So it's what can we take off the table so that we can make these things affordable? And AI is going to play a significant role in being able to personalize to the individual needs of students. And in doing that, we have to be honest, it's going to change the role of teachers. And part of that change needs to be to make it easier to be a teacher or a nurse, and make that job itself an easier and more attractive job. And the preparation for that job is cheaper and easier than it has been in the past, so it will push people into those professions.
David, we could do a whole panel. We could do 10 whole panels on the conversation of what does education look like in the future, and what changes can we make to make degrees more affordable. But great points. Austin, we're going to come your way for your thoughts on this.
To make your perspective, I think it's kind of obvious. If you want to fill critical shortages, then the value proposition or the return on investment for those degree programs needs to be strong. It needs to be strong both into and through the degree program and then into career. And I think this sort of speaks to David's sort of point about the financial viability of programs. That's on the institution side, and we're thinking about this from the student side. But I think there's two things that policymakers can do, and one sort of obvious, but I don't think it's universal, is that do policymakers have the information that they need to understand sort of the cost equation for students who may want to enter into social value careers? I sort of brought this up earlier. Do the tuition costs align with the workforce payoff? And what's pretty interesting if you're a policymaker, especially if you're in a publicly funded field, is you have students that are going into teacher prep programs that are public. They pay tuition dollars for that. Then they have licensure costs that are publicly sort of set. And then, of course, they go into the teaching profession, which is largely in public schools. And oftentimes, do those costs of actually getting the degree align with that financial payoff? And so policymakers have quite a bit that they can do along those lines. But they have to have the information to know whether or not there's actually a payoff. And I think there's a lot of different ways that they can get that data, whether it's back of the napkin math or whether it's actual, state longitudinal data systems or other information available. Then once you have that, it's what combination of supports do you put in? Do you try to incentivize through financial aid? Is it scholarships, loan forgiveness, tax credits? Is it creating a tuition guarantee for specific types of programs? Say, if you want to be a teacher in our state, it will be free for you. Or do you focus on some of the barriers that students are in those programs are facing to actually getting that degree, and then additionally invest in student supports that might help them get across the finish line? A lot of different ways to approach enhancing that ROI, but it's absolutely critical if you want to fill these shortage areas.
Right, right. I'm going to combine a couple of your answers here, and then I want to get us into a specific kind of solution that's been brought up. What do you think about this idea of employers being part of the value equation? You could think about it in healthcare, where employers are part of the funding mechanism for tuition for healthcare professions, because the needs are so acute that it begins to make sense for employers to be, involved as a payer in some way, to incentivize students to get into these degrees. Is there any place for that kind of a solution?
I think absolutely. We see hospital systems in Utah partnering with universities and saying, if you go to this university, we will pay for your tuition, and in return, you give us so many years of service back. 1,000,000%. And where we are not getting the recruits that we need organically, we will go out and produce those. And that's giving, someone who may be a nurse's aide who would really like to be a nurse, but maybe can't afford that tuition. I can already see that you're a great work ethic. You have great skills to offer our company. Let me pay for your schooling. And in return, there's a natural a relationship. They appreciate the company paying for that tuition. And in return, we know that we're going to get someone that we're willing to invest in because we've already seen what their work ethic happens. 1,000,000%. If I could piggyback back on what Dave said earlier about technology, the days of, I call it the sit and get education, where I just sit in a room and we'll look at a whiteboard and listen to someone opine for an hour, those days are gone. I'm the chairman of a board of a medical school. This is a DO school that we teach 7-minute vignettes, and it is all on computer, and there's a pod of 4 people, and they break down that 7-minute vignette, and they're taking a multitude of tests, and we're going along, but it's all technology. No longer is it in the classroom. It may just be in a study room someplace. The way students learn, today's newer generation of students, it is through technology. Sit and get is no longer an appropriate or maybe an effective way to teach.
Right.
Absolutely. I agree. And a couple of examples on the relationship between the employer and the training and the delivery model. When I was at Johns Hopkins University, the College of Nursing is right across the street from the hospital. Had no problem getting the hospital to pay for the generation of nurses. So the nursing programs are subsidized by the hospital, the employer that needs them, and they provide all the preceptor placements and everything that you need. But they were both owned by Johns Hopkins Enterprise and the university. The other example is we do a lot of work with school districts now where they're growing their own. So they're taking their administrative staff and their paraprofessionals and growing their own and supporting them in their current job to move into the teaching profession. Those types of models and paid internships and paid residencies are all things that help people make a connection between the needs of the workforce, the specific needs of specific school, where the receptionist at the front desk of that school is becoming a teacher. She knows exactly what's needed in that particular school, or he does. And those things are a growing part of our enterprise.
Austin, I'm going to give you the last word.
Yeah. So we've been working with legislators on sort of how do you go about change making in higher education. And certainly we look at the policy levers that you can wield, but we've also sort of expanded the scope. And I think your comments about, can employers be a part of the value equation really sits with that. We're also working with legislators to say, how can you as a convener, as a representative, build these relationships, build these bridges to, create these sort of public-private partnerships, which may actually make better change than what you could do within the legislature. But maybe it's a yes and strategy. And so we're really helping them think really holistically about all the different ways that they can go about it and make sure that higher education is delivering those degrees of value, particularly in these critical fields.
Right. Well, David, Francis, Austin, thanks for your insight. We look forward to working with states and with the federal government, with accreditors and other partners to better direct talent to these critical workforce needs. We appreciate your time this afternoon. Thanks.
Thank you.
Thank you.